My name is Szeles, and I'm a postdoctoral fellow and researcher at the Medical University of South Carolina. My primary practice is in neuropsychology, or the study of brain-behavior relationships. So I often see patients with a wide variety of cognitive disturbance or disorders of cognitive function. So in most cases, while the patients that I see often have very identifiable causes of their disturbance, like stroke or traumatic brain injury or other neurodegenerative diseases, oftentimes I also see very healthy adults who are complaining of memory problems. Oftentimes this is a result of very transient factors that can very easily be affected or adjusted by the medical team or by referrals to other providers to help with management, like life stress or emotional difficulties or even medications. And in the case of the latter, when we're able to identify that medications are a problem, we can recommend some treatments or adjustments by the medical team, and this can be adjusted accordingly. Oftentimes, though, we don't have a very great handle on certain medications, and so we need more empirical support or evidence as to a relationship between those medications and cognitive function to better understand how they affect our thinking and memory. One such medication is a class of drugs intended to reduce levels of LDL cholesterol, or bad cholesterol, to help reduce vascular events. If you've ever heard of this term, statins, it's because many Americans today are already taking this drug, which means that many individuals in your family, or even yourself, might be on this drug. In 2012, the FDA issued a warning label that memory loss had become an identified side effect of statin medications. And we have reason to suspect the cause of this underlying observed finding. So while cholesterol is thought to lead to the buildup of plaque in our arteries, leading to things like stroke and heart attack, it's also a critical building block for myelin, or the protective insulation for our axons, or the connections between the neurons in our brain. So the implication is that if we artificially adjust the levels of cholesterol in the body, we may be affecting the brain's ability to maintain optimal brain function. So this is less of a concern in those at very high risk for these vascular events, but it turns out that more and more Americans are being prescribed this medication as a hopeful preventative to prevent future plaque buildup and future vascular events. So the support for primary prevention in these individuals is quite limited, and so what we're trying to do with this project is better understand the relationship between this medication and cognitive function, so we can better understand the consequences that might result in otherwise very healthy adults. So there's a huge need for this, because this will allow us to better prevent vascular events in those at very high risk, and also help us recognize when we should be reserving treatment for those at lesser risk. We're very excited about what the study might reveal because it truly is a win-win situation. So on the one hand, if we find that there's no connection between statin medications and cognitive function, then we can take the FDA warnings with a grain of salt, and that's great news. However, if we do find that there is a connection between statins and cognitive function, it's a very important relationship that we establish now, so we can help this research support future research studies where we can identify those at greatest risk. So if you or someone you know is taking a statin medication currently, and it's very possible that you'll at least be offered a statin medication at some point in the future, it's very important that we establish this connection now. Thank you for supporting my project through Donors Care. I look forward to keeping you updated.